Welcome to the Safe Passage for Children of Minnesota podcast. Safe Passage for Children's mission is to ensure that Minnesota has a child welfare system in which children are safe and can reach their full potential. This series of episodes will take a closer look at our short weekly policy blog, or e-brief. If you know someone who cares about children, be sure to share this podcast with them. Stick around for this week's e-brief podcast episode featuring Safe Passage for Children's Executive Director, Rich Gurman.
Safe Passage for Children releases report on Minnesota child fatalities. Yesterday, Safe Passage for Children released its year-long study of Minnesota child fatalities from maltreatment from 2014 to 2022. There is a link in the blog to get to this report. The report reveals a number of concerning patterns related to child welfare in the courts, and they include repeated inappropriate assignment to family assessment, which is the supposedly low-risk track of child protection, inaction on chronic maltreatment, neglect cases with numerous chances for parents to address problems, returning children home too soon, missed red flags by medical providers, children killed in kinship foster care placements, child torture cases, children returned home to seriously mentally ill parents, differences in sentencing between parents and non-parents, issues raised by plea deals, inconsistent mandates and protocols among the courts, and ineffectiveness of no-contact orders in domestic violence cases. So with your help, this report can spur some positive improvements in Minnesota's programs to protect children. So as the blog mentioned, Safe Passage for Children released a major report yesterday on child fatalities in Minnesota. This took over a year of work, and it covers the period from late 2014 to mid-2022. If you don't have the blog and the link in the blog, you can get the report on our website, which is safepassageforchildrenmn.org. Now, the report is 47 pages long, plus some appendices. So we're not going to try to cover all of the main findings in this podcast, and we will dive into some different sections of the report over time. To start, however, let me share with you how we did the report, and a lot of this is in the report, but let me just give you some highlights. Our initial source was media reports about children killed from abuse and neglect, and as you will see, we had to start there because the State Department of Human Services doesn't make its information about child fatalities public. So based on these media stories then, we were able to identify 88 children who were killed during the time frame for the project. And once we had this information, we were able to use a Minnesota statute which requires counties to write a fatality report on such cases if anyone from the public requests it. Counties were mostly cooperative with these requests. However, we only got reports on 55 of the children. In 21 cases, the counties couldn't find their own case records, even though the cases were known to us through the media and were in the court system. In some cases, we couldn't get a report because the situation was still going through the criminal courts, which exempts counties, and appropriately so, from responding to our request until that process runs its course. A number of the cases were Indian Child Welfare Act cases, or ICWA cases, which are not in the state court information system. And in a few cases, the county redacted all the identifying information, which didn't make sense because we already had it from the media stories. In fact, we gave it to them in the request for the report, and they were in the court documents. So that was odd, but only a few of the counties did not respond to our request at all. So one of the disappointments from this project was that the State Department of Human Services does keep an ongoing inventory of child fatalities from maltreatment, but they refused to share information from the inventory with us. Even had they been willing to share just the names and not, the full report that they get from the counties, we would have been able to follow up on most cases by then looking at the court records in the state Minnesota Court Information System, which is known as MinSys, or by getting a fatality report from the county. They did let us know, however, that there were 161 such cases during approximately the same time frame that we were studying. Our inability to look up the entire population of child fatalities led to a potentially serious limitation in our report. In short, there's a concern that many, if not most of our cases involve death through violence against children, and our 88 cases out of the total of 161 could be underreporting child deaths from neglect. Nevertheless, and as we say this in the report, we think the 88 cases stand on their own in the respect that they include many serious problems that would need to be addressed, even if it turned out that they in some way weren't representative of the system overall. There were a number of findings that especially surprised or concerned us. To begin with, 14 cases, and that's nearly 1 in 5, included elements of torture, and at least 5 were unambiguously torture cases. To determine this, we used 3 separate definitions of torture, which are detailed in the report. In most instances, the difference between the 14 cases with elements of torture and the 5 that clearly were torture was that there was no information in our sources about psychological abuse, which is one recognized component of torture. However, given what is known about torture and based on the information in the case records, it was hard to picture in most of these cases that the degree of not only physical abuse but efforts to degrade and dehumanize the children did not include psychological torture. So we think we were really conservative in saying there were only 5 such cases that met all the criteria. Another major area that we explored was chronic maltreatment, or chronic multi-type maltreatment as it is defined by one of our subject matter experts named D. Wilson. Dee has a lot of great writing on these and similar topics in his blog, which is called The Sounding Board, and which you can find online and which also frequently appears in the national online child welfare newsletter called The Imprint. Dee refers to this phenomenon as chronic multi-type maltreatment, which he describes in detail in his report, because, in brief, it refers to situations that may start out as relatively uncomplicated neglect cases, but which over time spiral downwards to include physical abuse, sometimes sexual abuse, and at times even torture. He ties this, phenomenon to a gradual loss of awareness of basic norms of parenting, and among other things uses the example of leaving an infant or a toddler alone for hours or even days at a time. So our report spends a fair amount of time also looking at the underlying causes of maltreatment and focuses on poverty as the best researched and most important single factor in causing child abuse and neglect. It is well known that there are major disparities in the child welfare system and that Black and Native American children are disproportionately represented both in child protection and foster care. In this regard, we quote from a famous study by Emily Putnam Hornstein, which included every child protection case in California, where she showed that once you control for indicators of poverty, such as receiving Medicaid, Black children are actually slightly less likely than white children to be reported to child protection or to be in open child protection cases or foster care. Out of this comes a discussion of the importance of relieving the burden of poverty in families, which, of course, would disproportionately benefit those families that are disproportionately in the child welfare system. As reported in an earlier podcast, there was a New York Times and Child Trends project, which they did together, which showed, surprisingly, that there has been a very substantial reduction in child poverty since the late 1990s. This they attributed to a collection of individual programs rather than some overall plan. So they include things like expanding the early income tax credit, food stamps, or as it is now known, the SNAP program, Obamacare, expanding the income tax credit for low-income families, and other similar programs. The report makes the point that these are services that caseworkers could focus on in Minnesota in helping families become eligible for those programs, which would in itself do a great deal of good in terms of helping families stay out of child protection. An important caveat, however, is that poverty relief efforts are ineffective in the cases we talked about regarding chronic multi-type maltreatment. These typically involve substance abuse or serious mental illness and are not amenable to any but the most high-level interventions. There have also been a number of programs and services that have been particularly effective in addressing child maltreatment, particularly neglect, and in addressing them early enough to make a difference. Our point at Safe Passage has always been that the system often reacts far too late. As is well known, the first 1,000 days of life are critical in the brain development, the social development, self-regulation, and other aspects of normal childhood development. So when the child protection system leaves infants and toddlers in situations where they are continually traumatized during these months and years, later intervention by the system may not make that much of a difference. In this regard, we stress in our report that it is critical for professionals in related human services fields to make child maltreatment a core part of their own missions. In part, this is because many of them reach families earlier than child protection, and also, as mentioned, they tend to be more trusted than child protection workers. So, if a public health nurse offers in-home parenting training services or a child care center offers an early learning scholarship to a family, it's much more likely to be accepted. There are other major findings to talk about, which we will cover in some future podcasts. They include situations where parents have chance after chance after chance to address the problems that got them into child protection, but fail to do so until something really bad happens. And in these cases, that is the death of a child. We also were unable to find information that mental health institutions and child protection workers are collaborating regularly on discharge planning when seriously mentally ill parents are sent home to care, especially for young children, although that could be partly the fault of court records that are insufficiently detailed. We also explore the issue of red flags that were missed by medical providers and a large number of children who were killed in kinship foster placements. So again, we will do deeper dives on some of these topics as we delve into this report further in the coming weeks.
Well, with that, I want to thank you, Rich, for sharing your time and your expertise on these issues. Again, if you know someone who cares about children, be sure to share this podcast with them. Until next time, this is Safe Passage for Children of Minnesota, working to ensure that Minnesota has a child welfare system in which children are safe and can reach their full potential. If you would like to learn more about Safe Passage for Children of Minnesota, please visit us on our website at safepassageforchildren.org. There you can sign up for our email list, read all of our eBrief blog posts, register for our free bi-monthly webinars, watch our featured videos, and more. You can also follow Safe Passage for Children of Minnesota on Facebook, Instagram, YouTube, Twitter, and LinkedIn.